So I'm going to go through the class of disorders known as anxiety disorders. I'm not going to go through every single anxiety disorder. I'm just going to give you enough so that you recognize what it is. But I'll go through the big ones. So in the current DSM-5, these are the disorders that are listed. I am going to go through the first four with you because those are the big ones: generalized anxiety, panic attacks, and phobias. But I'll briefly explain the others on the list. So starting with separation anxiety disorder, this is really a disorder in children when you remember separation anxiety that all children go through at a particular age. So this is a disorder where the child becomes excessively anxious when they're separated from their parents or caregivers. And remember that general rule, it has to cause significant distress, disability, or both. So it's interfering with daily functioning. Next on the list, we have selective mutism. And this is really what's also known as situational mutism. So it's an anxiety type of disorder where the person who can normally speak, they're normally capable of speaking. There's nothing wrong with their speech mechanisms. But in certain situations, they cannot speak at all. It usually coexists with like a social anxiety disorder, or sometimes you see it with autism. Okay, so because I will talk about phobias, I didn't realize I put that there twice. The next one we'll look at are social anxiety disorders or social phobias. And this is really an intense, persistent fear of being watched by others or being judged by others. Again, causes distress, dysfunction, disability. So it can affect somebody's ability to work, go to school, do other day-to-day activities. Can make it hard to make friends and to keep friends. Social interactions, just everyday social interactions, cause an irrational amount of anxiety, fear, self-consciousness, embarrassment. We also won't spend much time talking about agoraphobia. This like literally translates into fear of the marketplace. So this would be a type of anxiety disorder where you fear and avoid places or situations that might cause you to panic, feel trapped, helpless, embarrassed. A lot of times you don't want to be around any sort of crowded area, and sometimes in severe cases of agoraphobia, people tend to stay home where it's safe or where they experience it as being safe. The substance medication-induced anxiety disorder would be an anxiety disorder where there's that nervousness, restlessness, or panic caused by taking a drug or the stopping of taking a drug. I think in most cases, though, this would be treated through substance programs. And lastly, anxiety disorder due to another medical condition. This is really exactly like it sounds. You have a medical condition, and the presence of that medical condition leads to the experience of anxiety. It could take the form of like panic attacks, like OCD-like behavior, generalized anxiety. And with that, starting with generalized anxiety disorder, I'm going to go through the main symptoms here. In the table that I gave you, and as I've continued it here, I want you to notice. That I have it in 3 columns. So I'm going to explain what I mean by that. So obviously, there's the name of the disorder. In the second column, it tells you really the number of symptoms you need for diagnosis. So like in this first part, generalized anxiety disorder, you don't see a number here. That means that everything here is necessary for the diagnosis. Here, you'll notice it says 3 out of 6. So for the diagnosis, I need these 2 things present, and I need 3 of these 6 items right there. So anxiety disorders in general, not just generalized anxiety disorders, but the entire class, it's the largest class of disorders, and it's about 2 times more common in women than it is in men. Looking through the first symptoms, one thing necessary for diagnosis is excessive anxiety or worry occurring more days than not for at least 6 months. 6 months is going to be this thing here, and the person finds it difficult to control the worry. It's like constantly what ifing about everything to clinically distressing levels. Always constantly paying interest on a bill that may never come due. And something to note with that the anxiety is free floating. It's not specific. It's not targeted at a particular object or situation. So looking at the remaining 6 symptoms, which you would need to have 3 of the 6 for diagnosis, starting with restlessness. So this would be this like inability to, to relax, being easily fatigued, having difficulty concentrating, being irritable, experiencing muscle tension. So one of the things that you might notice if you are, anxious or stressed in general, is that you tend to hold this tension in the muscles of your body somewhere. So if you remember back when we were going over stress and health, we talked about ways to reduce stress, and progressive muscle relaxation was one of them. So like if I were to take my toes and like curl them up and hold them for a little bit and then release, and do that a number of times, and like kind of just work my way up the body, like tensing certain muscles and then releasing, I might discover, where I'm holding that tension, which is not very often for people in the neck or the shoulders, the back. So progressive muscle relaxation will kind of help you kind of relieve that tension and let go of some of that tension. The sleep disturbance can be insomnia or hypersomnia. So insomnia is that inability to fall asleep, and hypersomnia is too much sleep. But what you would notice frequently with anxiety disorders are that they have sleep disturbances. In some cases, people with depression or anxiety will go to a doctor to try to get something to help them sleep, when often the sleep disturbance is a symptom of something larger, like an anxiety disorder or depression, something like that. And this is a general rule of thumb. This is not 100% true. This is just a general rule of thumb, since you see the sleep disturbance with depression and anxiety, that depressed people tend to have a bit more trouble falling asleep. Anxious people tend to have a bit more trouble staying asleep. But again, it's a rule of thumb. It's not true necessarily in 100% of cases. Now for panic disorders, here you have, again, there's nothing marked here, so you need both of these things. Recurrent unexpected panic attacks, and it has to have been for 1 month or more. And it's going to like lead to this persistent, as we kind of get into this, concern about having additional attacks. So you'll need 1 out of 3 of these symptoms for the rest of the diagnosis. So that, again, that persistent concern about having additional attacks, worry about the implications of the attack or its consequences, and a significant change in behavior related to the attacks, often avoidance behavior. You kind of think of negative reinforcement, how that can, like, all right, so I'm having a panic attack and I remove myself from a situation, the panic attack goes away, thus sort of reinforcing the avoidant behavior. And that would be one example of the type of change you might see in behavior related to panic attacks. One thing you want to note here with panic disorders is that when these panic attacks happen, they tend to come on suddenly. So people tend to be very surprised by the, when they come on, the onset seems to be quick. But the panic attack itself is also brief in duration. Okay, so looking at panic attacks and what they look like, you'll have in a panic attack, these 2 symptoms need to be there: this discrete period of intense fear or discomfort, and the symptoms have developed abruptly and reached a peak within 10 minutes. As far as the symptoms that you would experience during a panic attack, you would need 4 out of these 13 here. So starting with palpitations, pounding heart, or accelerated heart rate. This is actually often why people think when they're having a panic attack that they're worried that they're having a heart attack. But the danger is actually almost non-existent with the panic attack in that way. So there'll be sweating, trembling or shaking, sensations of shortness of breath or smothering, feeling of choking, chest pain or discomfort, nausea or abdominal distress, feeling dizzy, unsteady, lightheaded, or faint, derealization, this feeling of unreality, or depersonalization, so being detached from oneself. So like when you think of derealization, think of some alteration of your perception or experience of your external world, something that's going to make it seem unreal. Although this is not exactly a match, you can kind of think of it as like if you think of a word and then you overthink that word and that word starts to sound real and doesn't seem real anymore, doesn't make sense anymore. It's a little like that with your perceptive world there. On the other hand, that depersonalization, where something feels like it's not part of yourself, like you're somehow detached or you've lost your sense of identity. Like maybe you feel really small or very removed from things that are happening, even though you're right there. Then you have that fear of losing control or going crazy, fear of dying, paresthesias, that's that numbing or tingling sensation, or chills or hot flashes. So the danger with panic attacks are really small to non-existent. I think the biggest issue would be sort of behaviorally, how you handle it when you have it. So even though it might feel like you're in danger or you can't breathe or you're having a heart attack or something, the actual danger is usually pretty minimal, and fortunately the panic attack shouldn't last too long. And the last one that I want to go over are phobias. So phobias, notice no numbers here, so you need all of these symptoms. This marked and persistent fear that is excessive or unreasonable, and it's cued by the presence or anticipation of a specific object or situation. For example, flying, heights, animals, receiving an injection, seeing blood. And this is what you want to notice is the big difference between panic attacks and phobias, a phobia disorder versus a panic disorder. The panic disorders are non-specific. Phobias are typically targeted at something very specific. So somebody could be claustrophobic or afraid of heights or what have you. Then exposure to the phobic stimulus almost always provokes an immediate anxiety response. The fear is excessive or unreasonable. The phobic situation is avoided or else endured with an intense anxiety or distress, and it does, as with most of these disorders, interfere with your normal functioning. A lot of phobias are really the result of having a very powerful imagination. So the more you can overthink something, the more you can sort of like get into your head and worst case scenario things, the more likely you would have trouble with a phobia. So some of the causes of anxiety disorders in general, starting with the psychological causes, you have faulty cognitive habits. This something that can make you be more prone to fear, overthinking something, really strong imagination, that sort of thing, and also hypervigilance. So again, constantly scanning the environment for signs of danger and ignoring signs of safety. You take ordinary threats and failures and magnify them. So you think you failed when you haven't, or you're so sensitive to criticism, you should all over yourself, that sort of thing. Another explanation for anxiety disorders would be maladaptive learning. So we're talking about conditioning and social learning. So in conditioning, remember we're thinking classical or operant. It obviously is not the only way to develop a fear response. In classical conditioning, you remember the little Albert studies. You have a neutral stimulus that doesn't elicit a reflexive response, right? So we take the unconditioned stimulus, loud bars, that loud noise, right? Banging those bars together. So the unconditioned response was a fear response. Pair it with the white rat as the neutral stimulus, and eventually the white rat becomes a conditioned stimulus, which gives you the conditioned response of being afraid. And negative reinforcement would obviously be a problem as well. So negative reinforcement has a tendency to strengthen fears. So like I could describe to you as I did, I think, going up to the cupola and panicking, the cupola at St. Peter's Basilica in Rome, and panicking and realizing, kind of coming down and away from it. As you move away from what's causing you a panic response or a phobic response, you feel better, and that feeling better is very reinforcing and can actually strengthen the fear, which is why when you're doing like exposure therapy or systematic desensitization, you don't want somebody to run away from their fear, because then you'll strengthen it. So if I'm going to expose you to this thing that you're afraid of, then you kind of have to stay there, and we use anxiety techniques to reduce your fear while you're in it. We don't want you to leave because we'll have made the fear worse. And the social learning side, remember, this is like the Bandura stuff, the modeling stuff. So what are parents and caregivers modeling? Are you modeling hypervigilant? Are you overprotective? Are you afraid that they're going to get hurt at every turn? Do you have them wrapped, take your kids and wrap them in bubble wrap so that if they fall, they don't get injured? That sort of thing will cause kids to be afraid of a lot of things in their environment. And in terms of this social, observational, or vicarious learning, there have been studies that have been done where they take monkeys and they spliced these tapes, right, to make it look like these monkeys were afraid of certain things that they weren't afraid of. And then had other monkeys watch these tapes to see other monkeys scared of stuff. And so it's just some toys. So they'd show a monkey scared of a snake, a toy snake, or a toy crocodile, or flowers, and a rabbit. And where the monkeys were previously not afraid of these toys, after watching other monkeys be afraid of them, the monkeys did end up afraid of some of the toys. So like the monkeys that were observing ended up afraid though of the snake and the crocodile, but not the flowers and the rabbit. So it does suggest that while phobias are learned, there's also a biological basis for it. There's a tendency for us to be more likely to be afraid of some things than others. So for the biological, remember, monkeys only vicariously learn some fears and not others. So there's a biological basis for this. There's an evolutionary predisposition to fear what was dangerous to our ancestors and not stuff that wasn't. We have genetic predispositions towards, say, having an overactive autonomic nervous system. So there are some people who would be biologically prone to respond, have an anxious or fear response more quickly and more intensely than other people, and that's a genetic predisposition. The disrupted biochemistry would come from the use of substances that can increase anxious responses, like caffeine, nicotine, hyperventilating, which is a mind-altering, although not a substance, but these things can all trigger anxiety attacks. And lastly here, the sociocultural aspects. So you take Western industrialized countries, they have actually more incidences of panic attacks. It's that fast-paced lifestyle, a decrease in job security, increase in mobility, lack of family support. These things will all lead to an increase in these types of disorders.